In 1800s, there was a family in Kentucky, USA called the Fugates, who became famous for having blue-colored skin. They were known as the blue people of Kentucky. As you can see in this picture, they were all blue because why they were blue? They had a rare condition that was called as methemoglobinemia. So they were blue, and they decided to live in seclusion away from other people because it was a social stigma for them. So they married among them, and then they had kids, as you can see in the hierarchy, and they had varying degrees of the diseased condition. Some had very much prominent conditions, some had less prominent conditions, but they were not having any symptoms. They were just living a normal life, but they had actually it was cosmetically very poor appearance for them. So they were very much worried, and then they were treated and all that case. But I am sharing this point because we are going to discuss a condition, methemoglobinemia. Our topic for today is methemoglobinemia. So what is methemoglobinemia? It is a actually condition in which the skin turns blue, okay, and the blood turns brown. Why? Because actually methemoglobinemia means that the methemoglobin is present in the blood, okay. So methemoglobin does what? It replaces hemoglobin, okay. And you know that hemoglobin is actually responsible for carrying the oxygen to the tissues. But when hemoglobin is replaced by methemoglobin, what happens is the methemoglobin binds oxygen instead of hemoglobin, and so the oxygen cannot be delivered to the tissues. Okay, so what happens is when the oxygen cannot be delivered to the tissues have lack of oxygen, so they turn blue. People turn blue, okay. So they look like these, as you can see, these cartoons, okay. So इस तरह से वो blue नज़र आते थे. They looked blue, okay. Their appearance was blue. So actually what happens that there is oxygen there. You should know normally there is oxygen. Oxygen is there, but the oxygen cannot be delivered to the tissues. So the treatment would not be to give oxygen to these people. Treatment we will discuss later. But what happens is that oxygen is there, but it cannot be delivered to the tissue. So what are the classical symptoms? The cyanosis, okay. Cyanosis means the blue skin or lips, even though the oxygen levels appear normal, but they have blue skin or lips, okay. So if you are seeing a person having blue skin or lips are blue, so you should think that whether there is no oxygen, but or whether there is oxygen but it is not being delivered to the tissues. You should have the methemoglobinemia in your mind, okay. So next is they have not a normal bright red blood, but the blood color is chocolate brown, okay. And they have shortness of breath, they have fatigue, dizziness. When the oxygen is not delivered to tissues, obviously these symptoms will appear. And the severe cases, they will have seizures and coma because the brain is not getting sufficient oxygen. But this is a severe case, okay. The person who is having a full form of the disease will be having these symptoms. Otherwise these people live a normal life. They live in the old ages also, if they are having just cosmetic problem, okay. Next are the types of methemoglobinemia you should be aware of. There are congenital and acquired, okay. Congenital means that, as you have seen this family, Fugate family, who all the people were blue, okay. So that was actually the congenital, which was being transferred from one parents to others. If the one parent was recessive, another was also recessive. So what happens, when they get married and they have children, they have the children who have the disease, okay. So it may be congenital, okay. And what happens in congenital case? There is a deficiency of an enzyme known as cytochrome B5 reductase, okay. It is actually autosomal recessive condition. So in the genetic disorders, we discussed about autosomal recessive diseases in details. That what happens in this autosomal recessive is both parents carry the recessive gene, okay, and they are not and when they marry, okay, when they have a child, what happens is the both recessive genes appear in the children, and they have the disease, okay, when both recessive alleles are there. So the both genes have recessive alleles and they carry the disease, so the children, okay. And the famous example we discussed is blue fugate family of Kentucky, which was congenital condition, but it can be acquired, which is most common. What happens is due to drugs or chemicals like dapsone, you know, that it is used for treatment of TB, and benzocaine, which is used in the anesthesia, okay, and the nitrates and nitrites, you know, that when the contaminated water or food is taken by the people, they have the contamination of nitrates and nitrites, and they do what? They actually do this thing. And they're actually seen in the infants who are given nitrate contaminated water, and then they appear blue, okay. Then is the diagnosis. How we diagnose the methemoglobinemia, okay. When you have a patient having blue lips or blue peripheries, and then you think that whether this patient is not having oxygen, or there is oxygen but the oxygen is not being delivered to the tissues, okay. So you will actually do what? You will think of oxygen, and you use the pulse oximeter to detect the oxygen levels, but oxygen saturation in those cases is 25%, means it's like normal, okay. But when we give these patients oxygen, the condition is not improved. It means that their treatment is not oxygen. They have oxygen, but they are not delivering to the tissue. So blood appears chocolate brown, and you confirm this problem with the help of measuring the methemoglobin levels. When the methemoglobin levels are greater than 1 to 2%, it means that this patient is having methemoglobinemia. So you diagnose the condition, and now there is a treatment like these fugates families were actually treated by a doctor who came to know about these people. The doctor used to give this methylene blue injection, okay, which does what? It converts the methemoglobin back to the normal hemoglobin, okay. So this injection was being used by the doctor, and it converted the methemoglobin to normal hemoglobin, and the condition improved, okay. They, for the first time in the history, the fugates saw themselves again pink, okay. So they were very much happy that we no longer have blue appearance. So the doctor gave methylene blue injection, but it's not easy to take injections every day, because when the injection is not being taken by them, what happened? They converted back to the blue. So the doctor used to give the methylene blue tablets, okay, and those patients used to take those tablets every day, methylene blue containing tablets, and then they had normal appearance. And they were so happy that now we can move around and we cannot be being socially stigmatized, okay. So methylene blue injection is being used for the treatment of methemoglobinemia, and if it is an acquired condition like by the drugs or chemicals, we used to avoid these things, and mild cases vitamin C may help as an antioxidant. So this is all about methemoglobinemia. I hope you enjoyed this topic. So what's the important takeaway to home? It's actually blue skin doesn't always mean low oxygen, okay. When you see a patient blue skin, you should not think that this person may have less oxygen. You should think of methemoglobinemia, especially if the oxygen therapy does not improve the condition. So I hope if you find a patient with blue skin, blue lips, like fugates, you can treat them. Thank you so much. I hope you enjoyed this video. Thumbs up, like, share, comment. Thank you. Allah Hafiz.